Today we'll be discussing a very important topic: obstructive sleep apnea. There are three types of sleep apnea. We have the central sleep apnea, obstructive sleep apnea, and complex sleep apnea. For the purpose of this advocacy, we'll be talking about obstructive sleep apnea. Obstructive sleep apnea is the commonest sleep-related breathing disorder in which an individual repeatedly stops and starts breathing during sleep. It can be severe enough that the individual will hardly have a good sleep. The cause of obstructive sleep apnea. Obstructive sleep apnea occurs as a result of the muscles of the throat. They call them pharyngeal muscles or pharyngeal tissues falling or relaxing and falling to the airway to obstruct the airway. These muscles of the throat are muscles that are keeping the tongue in place, muscles that are keeping the roof of the throat, refers to as the soft palate, muscles that are holding the back of the throat to keep it in place. They are referred to as the pharyngeal muscles or the throat muscles or pharyngeal structures or pharyngeal tissues. So obstructive sleep apnea occurs as a result of these muscles relaxing and falling to obstruct the airway. The airway is the place that the air passes when you breathe. Air passes down there to your lungs for gaseous exchange, and the carbon dioxide will not be excreted through that airway. Obstructive sleep apnea is manifested during sleep. This obstruction is usually manifested during sleep, such that the victims will suddenly wake up and be gasping for breath, feeling choked, feeling like one who is almost losing it, not able to breathe. Will be gasping for air, feeling choked. That's obstructive sleep apnea because of the obstruction caused by the muscles and the structures in the airway. This usually occurs up to about 5 to 30 times in 1 hour during sleep. You can imagine all that happening the whole of the sleeping period. Somebody sleeping for 5 hours, for example, having sudden interruption in sleep for about 30 times, 30 times 5 hours, that would be about 150 times interruption during sleep, such that the person is not able to maintain good sleep to the level of having a deep sleep that is needed for rest. The person is not able to sleep smooth enough to achieve a deep sleep that is needed for restfulness or adequate rest that will be needed for restoration, rejuvenation, and healing that is benefited during sleep. It's repeated and it's transient. Wakes up, it takes 2 deep breaths for the person to be able to recover from the effect of airway obstruction. After a 2 deep breaths, the person recovers and falls back to his sleep, so that the person involved or the victim is not able to identify or even know that is having obstructive sleep apnea or is having interruptions in sleep. It takes the spouse or the other person that is sleeping in the room with the person to be able to say that you don't sleep well. You wake up at night, you stop breathing at night and wake up and then starts breathing again. During that period where the person is not breathing at night, the brain senses it and wakes up the person. So you are awake, the person is awake to breathe and then falls back to sleep. And this can happen, like I said earlier, 5 to 30 times in 1 hour. Waking up to take the breath, which is about, you take 2 deep breaths to be able to recover. It takes about 2 deep breaths to be able to recover from the effect of that. And once the recovery happens, the person falls back to sleep. And the person is not able to know. Some people wouldn't even know that they have obstructive sleep apnea until it is severe enough to begin to impact their health significantly and negatively before they will now know that they have obstructive sleep apnea. Symptoms. The symptoms are 1, snoring. People with obstructive sleep apnea tend to snore heavily to the extent that it disturbs their own sleep and disturbs the sleep of as many people that are sleeping in the same environment with them. If they are married, people with obstructive sleep apnea will tend to sleep, their partners tend to sleep in another room because the snoring is loud enough to disturb their own sleep, prevent them from falling asleep or maintaining a good sleep. So snoring is one of the symptoms and signs of obstructive sleep apnea. 2, daytime slowness and excessive sleep during the day. You see people with obstructive sleep apnea sleeping, always sleeping during the day because they didn't have a good sleep at night. They were always interrupted. So they sleep during the day. They can sleep when eating. They can sleep when walking. They can sleep even when driving during work. And this will not impede on their performance. So they are seen to have poor performance at work, poor performances. If it's school too, they will have poor performance in school. They have lack of concentration, easy fatigability during the day. They want to just sleep. They are tired. They are not able to concentrate. They are involved in mood swings. Before you know it, they are sad, or they just swing here and there. Some can be depressed and they are easily annoyed. They are highly irritable. They will have high blood pressure. And when it comes to the issue of high blood pressure, you have to look at it because high blood pressure is a risk factor for obstructive sleep apnea, meaning that it can predispose an individual to having obstructive sleep apnea. Why obstructive sleep apnea? Because of lack of good sleep and lack of rest can also predispose an individual to having high blood pressure. That's hypertension. So when it comes to hypertension as one of the ways they present, you will have to look at it critically. Is it the obstructive sleep apnea causing hypertension or the hypertension that is predisposing an individual to having obstructive sleep apnea? They lack interest in sex. They tend to care little or not at all about sexual relationship. They tend to have early morning headache. They wake up, they complain of headache in the mornings. They have dry mouth and sore throat in the morning. This is because sometimes they have to open up their mouth, in trying to find a way to breathe, to bypass the airway obstruction. These are the ways they manifest. So what are the risk factors for obstructive sleep apnea? 1, overweight, obesity. People who are very fat have been seen to have deposited fat in their throats. And for that reason, when they sleep, they tend to obstruct their airway easily because they have fat at that area. However, it is not everybody that have got obstructive sleep apnea that is fat, that is overweight, that is obese. There are people who are not overweight that still got obstructive sleep apnea. 2, alcohol consumption. Alcohol consumption is a risk factor for obstructive sleep apnea. Alcohol causes the relaxation of the throat muscle, of the throat muscles, and when these muscles are relaxed, they fall in the airway and obstruct the airway. And this is especially worse during sleep. 3, diabetes mellitus. Diabetes mellitus have been seen to be a risk factor for obstructive sleep apnea. People who have chronic nasal congestion are said to be at twice risk of having obstructive sleep apnea. And so, if you have recurrent or chronic nasal congestion, you need to see a doctor and get that, treated on time so that it will not predispose you to the risk of having obstructive sleep apnea. Obstructive sleep apnea is said to be commoner in men compared to females. And this is so before the menopause. Postmenopausal, postmenopausal women are said to have same risk, that's 2 to 3 times risk of having obstructive sleep apnea. So it is less in premenopausal women. And old age, with increasing age or advancing age, there's said to be increasing risk for obstructive sleep apnea. However, this risk is said to level up between the ages of 60s and 70s. All right. So another risk factor for obstructive sleep apnea is asthma. It has been seen that people who have asthma are said to be at a higher risk of having obstructive sleep apnea. And another risk is family history. It is said that families where we have people with obstructive sleep apnea, the children, siblings, and members of that family are at risk of having obstructive sleep apnea. And there's another risk refers to as the narrowed airway. There's a trait for narrowed airway, and that trait can grow in family, okay? And so, if somebody's relation or a direct sibling is having obstructive sleep apnea, it can also happen to another sibling because of a narrowed airway, and that trait is passed down the family line. And another thing that can be responsible for narrowed airway is when you have the tissues and structures of the tissues that we have in the throat. We call some tonsils. We call one tonsils, another adenoids. This adenoids from inflammation, recurrent inflammation, it can become enlarged. They call it tonsillar hypertrophy or adenoidal hypertrophy. When the adenoids and tonsils are hypertrophied or they are enlarged, they can cause airway obstruction, resulting in obstructive sleep apnea. They will now talk about complications resulting from obstructive sleep apnea. Remember, because they don't sleep well at night, so you see them always sleepy during the day, daytime slowness, confusion, lack of concentration, poor work performance, not doing well at work, not doing well in school, lack of concentration, because there is no good sleep. Mood swings, highly irritable. They have marriage problems either from the fact that their spouses are not able to sleep by their side because they snore a lot, are not able to sleep in the same room with them, or because of lack of interest in sexual relationship in marriage. They come not doing so well at work, quarrel, highly irritable. These are complications of obstructive sleep apnea. And they are cardiovascular complications of obstructive sleep apnea. We talked about hypertension. There are risks of abnormal heart rates, tachyarrhythmias, that will predispose them to heart failure, heart attack, cardiac arrest, cardiac arrhythmias that will predispose them to sudden death, pulmonary hypertension. These are all cardiovascular problems that are associated with obstructive sleep apnea. So that kind of heart failure, they refers to it as cor pulmonale. They will have that problem. All these are complications of obstructive sleep apnea. Obstructive sleep apnea too can predispose an individual to being depressed. Somebody who's not able to sleep, not able to concentrate at work, having poor performances, they can mood swings and they can become depressed and then be bothered about what is happening to them. People with obstructive sleep apnea, research has got it too, that they are at risk of eye problems, especially the glaucoma. But these eye problems can actually be attended to. There's a medical treatment for obstructive apnea-induced eye problems. So what do you do for people with obstructive sleep apnea? In making the diagnosis, knowing such people, one, a good history. The history alone can give it away before you start doing tests, before you start examining them. When from your history, when you talk to your doctor, you talk to your doctor about suddenly waking up, gasping, choking, fighting to breathe, fighting for breath, and how that happens often in the night, and so you are not able to have a good sleep. You complain of snoring heavily. If you're not the one complaining, maybe your spouse or a family member that sleeps in the same room complaining of you suddenly waking up, snoring, not sleeping well, and at a time not breathing. I've seen a man whose wife complained of sometimes he looks at his man's chest and it's like he's not breathing. And as the time he notices that it's like he's not breathing, he suddenly wakes up and is gasping and choking. A good history will prove or show or will point towards the fact that you have obstructive sleep apnea. So they will not examine. In examining the things that you can see, they examine your throat, examine your tongue, examine your neck to look out for those risk features or things that will suggest that your airway is occasionally obstructed during sleep. And they can also, in examining, they can look at your waistline, they can measure your waistline, measure your neckline, measure your neck, because weight gain is also a risk factor for obstructive sleep apnea. And after that, they can now investigate the tests that they do. Sleep study. they want to be sure whether you sleep well. They want to see what will happen during sleep. So they can do sleep study, which can be done at home or done in the hospital. They call it polysomnography. So they look at your sleep pattern. This one can be done for the entire night, and it can be done splitted. They call it splitted polysomnography, in which when you sleep, the medical personnel doing the test for you can wake you up, having made the diagnosis of obstructive sleep apnea, and now give you positive pressure ventilation or support to see how your sleep pattern will now be. You know, all of this sleep study is to make the diagnosis of obstructive sleep apnea. All right, and the other things that can follow obstructive sleep apnea, these other complications, can be looked at for in the course of you being assessed for obstructive sleep apnea, whether there's hypertension and all that. Another thing that can be a risk factor for obstructive sleep apnea is diseases that can predispose to obesity. Aside obesity, people who have polycystic ovarian syndrome, they are at risk of having obstructive sleep apnea. This is because that syndrome predisposes them to having overweight. And people who have hypothyroidism, they are at risk of having obesity too, and then obstructive sleep apnea. So what are those things that will worsen obstructive sleep apnea when you already have obstructive sleep apnea? When you are adding weight. So losing weight will favor you, will be better to make your way or to make your symptoms better. So when you are adding weight, it will worsen it. When you lie flat, we call it lie supine. When you lie on your back, it will worsen obstructive sleep apnea. And so it is discouraged that you don't lie on your back, because when you lie on your back, your tongue and the structures in the throat will fall backward and obstruct the airway. It is preferably that you lie on your tummy and make your airway to open, make your throat to open so that you can breathe. And again, or lie on your side so that your tongue will not fall back to the airway when you are sleeping. But do you know that when people sleep, they don't know when they roll and lie on their back? So what people tend to do to prevent them from lying on their back is to ensure that tennis balls are sewed to their pajamas, okay? The blouse or your shirt, any shirt that you used to sleep with, the pajamas that you sleep with, you know, they will sew balls, tennis balls, maybe 3 or 4, to the back of that shirt, such that anytime you lie on your back, it will be uncomfortable because of those balls. So it's either you are lying on your side or you are lying on your tummy. Another thing that can worsen the symptoms of obstructive sleep apnea is when you take sleeping pills, sedations, okay? Drugs that can put you to sleep, maybe because you think you're not sleeping well, you've not rested enough, okay? People that will take sleeping pills, it will worsen your obstructive sleep apnea. There are drugs that they give for pain relief. They call them opioids. People who take opioids, it will worsen obstructive sleep apnea. I already told you alcohol will worsen it because it causes the relaxations of the muscles of the throat. So you should not be seen to be taking alcohol or seen to be taking opioids or sedative. It will worsen obstructive sleep apnea. Other things that is seen to also worsen obstructive sleep apnea is general anesthesia. Okay, people who are coming for surgeries that will involve putting the person to sleep, giving the person's pain drugs that are opioid class and all that, you know, such people will be at risk of complications, worsening symptoms. So if you are going to have a major surgery, a surgery that you need to go to sleep, you need to talk to your doctor about your sleep problems. Talk to your doctor about obstructive sleep apnea. And again, if the diagnosis is not made, yes, you don't know whether you have obstructive sleep apnea. You snore during sleep, you suddenly wake up and you'll be breathless. You know, you suddenly wake up, you sleep too much during the day, you hardly concentrate. When you are coming to have a major surgery, talk to your doctor about it so that they can evaluate you for obstructive sleep apnea and take the precautionary measures to ensure that you are safe after anesthesia and surgery. These are things that will worsen obstructive sleep apnea. Then coming to treatment, I want you to know that you must seek medical advice. In fact, I will tell you as a man or as a postmenopausal woman or as anyone who is having problems with sleep, you need to consult a doctor. Let them be sure of what exactly is causing the problem, whether you have obstructive sleep apnea or other differentials like narcolepsy, other things that can make you sleep too much during the day. It should be ruled out. Okay, so you must present to the doctor. So when should you present? If you sleep too much during the day, if you hardly concentrate, you sleep up when you are driving, you sleep up when you are walking, you sleep up when you are doing TV, you lack concentration, you are highly irritable, you have mood swings, your blood pressure is beginning to rise, or you have hypertension, and your partner is complaining that you snore too much, all right, or even complain that sometimes during the night you stop breathing, and you are arguing, you don't want to agree to that, please, it's not a thing of denial. It's not by you denying. Go sought medical help. Let them do a sleep study for you, whether at home or in the hospital premises, and rule out obstructive sleep apnea. The complications from obstructive sleep apnea can be the reason for sudden death, can be the reason for cardiac failure or cardiac arrest, can be the reason for cardiac arrhythmias when the person's heart rate is no longer within normal reading, it's now too fast. It can be the reason you will even have problems in your marriage. You know, your wife seems not to be attracted to you. You know, you are not showing interest in sexual relationship. You're not showing interest in your spouse. You want to go and sleep in a separate room from your partner. So complications of obstructive sleep apnea can actually be that serious. So seek medical advice, sought for help, okay? And be sure you are doing something about it. There are several options for treatment. Actually, the purpose of this lecture at each time is not for you to begin to treat yourself. It's for you to have information that will help you prevent comorbidities and mortality from the pathology that you got. So to enable you know when to seek for medical help and run for your dear life, you know, seek help so that there will not be episodes or incidents of sudden collapse or sudden death or sudden cardiac arrest, and they will say somebody just suddenly died. You know, in my previous lectures, I've told people there's nothing like sudden death. There are symptoms. There are things that has been happening in the person's life that the person has, has undermined, that the person didn't pay particular interest to, that now manifested full blow to a sudden collapse or sudden death. So you must not be careless. You must be seen to seek for help. But for a matter of just touching them, just giving some information, you know, the options that you got for treatment of obstructive sleep apnea after you have taken lifestyle changes or modification into play will be 3. I'll talk about them, but I think I should quickly talk about lifestyle changes or lifestyle modification that will promote or support health when you have obstructive sleep apnea. 1, go and lose your weight. Every effort at losing weight will benefit you. When you lose 10% of your weight, you will see improvement in your symptoms. Lose weight. Some people get a very good relief from obstructive sleep apnea when they lose their weight. In fact, that alone can even treat some people's symptoms. 2, exercise. When you do regular routine exercise, aerobic exercise, it has been seen to help improve your symptoms, to help improve your heart, cardiac symptoms, to help improve your airway, tone up your muscles, okay? Exercise is something you need to do. Run away from sedatives, drugs that will make you sleep, drugs that will obstruct your airway, okay? Ensure that you are seeking medical help for things that you do not understand. Don't lie on your back. I already talked about that. Don't lie on your back. Ensure you are lying on your side or lying on your front. And not lying on your back. I told you you have to do something. Put balls on your gown, on your pajamas, or your sleeping gowns, or your night gowns, so that it makes it uncomfortable. Even if you roll to your back, you can roll out or roll away. Ensure that you lie, if you are still able to control that, to lie on your tummy. That will take away your tongue. So having taken all precautionary measures and things that will promote health with obstructive sleep apnea, the options you have are 1, they call it positive airway pressure. It can be continuous, it can be bi-level, it can be auto level. Okay? Continuous positive airway pressure is needed. It's called CPAP. Okay? You need a CPAP support during sleep, and they usually get that from a machine. There's a machine that supports you, that helps to do that. And that machine can be from a nose mask or a face mask or a mouth device. All it does is to use pressure to make your airway open, to push things away from your airway. In continuous positive airway pressure, that's the CPAP, the pressure is already set, and that pressure will be there all through the night while you sleep. While the bi-level positive airway pressure, it gives a different pressure when you breathe in and another pressure when you breathe out. This is used for people who are not able to tolerate continuous positive airway pressure, are not able to tolerate the CPAP machine. They might tolerate the bi-level positive airway pressure, or BiPAP if you want to call it that way. And there's another auto CPAP or auto PAP, which is automatic. What it does is that it reads the pressure in your airway and deliver the pressure that is able to open up that airway. Okay, so it looks at what is happening there and sets its own pressure that is able to keep the airway open for you to breathe. So for people who have these devices, they have been seen to now breathe well, have a good sleep, have their symptoms controlled, have a good quality of life, able to concentrate at work, now able to control their mood swings and all that, do no longer sleep at work. You know, their majority or significant percentage of their symptoms, you know, seem to be relieved using CPAP. However, the problems with having to use that, some people don't tolerate it, they find it uncomfortable. But I want you to know that if you are using a CPAP machine, you can actually arrange it in such a way that you are not able to sleep well and tolerate it, while you are still able to deliver or administer the pressure. You know, use your straps in such a way that they are not too tight to cause nerve injuries to your facial nerve, to cause facial swelling. You know, the straps to your mask should not be too tight, but it should be good enough to be able to deliver the pressure that is needed to keep your airway open. Some people will talk about the noise of the machine. Older designs of CPAP machine were very noisy, and they said the noise was significant enough to also interfere with sleep. But recent or new machines are beginning to be better in terms of noise and not too noisy again, such that people cannot tolerate it. For people who cannot tolerate face mask, there's a nose mask. You cannot tolerate nose masks. You know, just keep doing something until you find which one is better for you. Please don't stop using your CPAP machine because you are not comfortable with it. With the help of your doctor and the medical team, keep finding how you will be able to tolerate the CPAP. Keep finding how you'll be able to bear the mask, whether it's nose or face mask. Don't just stop or discontinue it, because it's like a medication. It's a therapy to keep you alive, to prevent complications from obstructive sleep apnea, to protect your airway and keep it patent. So keep using it until you find the help to make it better. That's the CPAP mask. Another thing that can be done, they call it the mouth device. The mouth device is put in the aura, is put in the mouth, as it is said, to push. What it does is that it thrusts forward the jaw in order to keep the airway open. It pulls the jaw forward. You put it in the mouth. I'm going to put a picture of it in this video. You put it in the mouth and it pushes the airway forward in order to keep the airway patent and prevent airway obstruction. This is usually used for mild to moderate obstructive sleep apnea. When it becomes severe, it might not be able to do significantly for you. Another thing that can be done, there are several devices now. And when you want to use the oral device, you need to be in dental clinic too, to be sure that it does not, you use the good size, the proper size, so that it does not affect the architecture of your teeth, okay? Because people can actually use the oral device and at the end find out that their teeth has got problem. So that is what you have to do. You have options of surgeries. When it becomes severe, it's not life-threatening, you know, there might be need for surgery. There's what they call uvulopalato-pharyngoplasty. The surgery is done to remove excess tissue in your throat, to make the way patent, all right? So those surgeries are done in extreme cases when the obstructive sleep apnea, when your obstructive sleep apnea is now in a constant threat to life. And the quality of life of people with obstructive sleep apnea is dependent on how you are able to manage your symptoms and prevent them. And that will depend on how well you have been able to use all the options that you have, but ensure that you are losing weight, even if you are not obese. Because there are people who are not obese, and meanwhile their fat gain is in their throats. They are extreme fat because they have a narrow airway. Their fat, any little fat in their throats, they will begin to obstruct. But meanwhile, looking at them, they are not obese, they are not overweight. But because they got a narrow airway, they gather any little weight they gain, it obstructs their airway. Some people have short neck, putting them at that risk, and they add their weight there, they might not look fat. Okay, so I want you to know that even if you are not fat, you are not overweight, you are not obese, if you have obstructive sleep apnea, still try to drop your weight further. This is because the weight you have gained is in the wrong place, which is in your throat. So when you drop your weight further, it will help to reduce the weight in your throat. So ensure that you are doing something concerning your obstructive sleep apnea, because it can actually put you at risk of having life-threatening complications. Hope you've learned something. Please share this video. You don't know when you'll be helping somebody who thought that his or her snoring and sleeping too much during the day was just a mere coincidence.